Now, these are the orbits where the medial walls are parallel to each other, while the lateral walls are meeting together near the sella turcica, and the eyeballs can be seen. This is the orbital axis and the visual axis with 22 degrees in between them. Now, these are the orbits in the skull. You can see the orbital walls, the medial, the lateral, the superior, and the inferior. Now, these are colored to see the many bones contributing to the orbital cavity and orbital walls. And now we know that the orbit is one of the parts of the body where it has surplus blood supply. This is the arterial supply to the area. Internal and external carotid arteries contribute to the supply of the area inside and outside the orbit. And this, the eyelid is supplied by many arteries to the upper lids and lower lids from the facial, lacrimal, and the internal carotid. And these are the arteries inside the orbit. You can see the ophthalmic artery with its branches inside the orbit, supplying the eyeball, the orbital contents, orbital tissues. The venous drainage again is surplus, and it goes to the cavernous sinus, to the cranium, and to the pterygoid plexus, and then to the facial vein. The orbit is one of the most crowded areas of the body with many cranial nerves. You have the second, the third, the fourth, the fifth, the sixth, and the sympathetic, of course, inside. So it is really a crowded area with nerves, very important nerves. Orbital surgery is a field where many specialties contribute to it. One of the specialties is neurosurgery. The relation between the orbit and the cranial cavity is very much intimate, and the whole orbital roof and the apex both are related to the cranial cavity. We can see here the orbital roof is opened, and you can see the orbital contents are in the great vicinity or close vicinity to the wall of the superior part of the orbit. And here is the same. You can see the tissues there. That's the periorbita scene where the orbital roof is removed, and that's the optic nerve emerging from the orbit, and the chiasma is there. So any changes in the orbital contents, orbital lesions may affect the cranial cavity. And that's close-up picture with the optic nerve entering the orbit, and you can see the subarachnoid spaces surrounding the optic nerve going inside the orbit with the ophthalmic artery showing. So any changes cranially again will be reflected to the optic nerve and the orbit maybe, and the vice versa. The other specialty related to the orbital surgery is maxillofacial surgery. Again, many facial bones are related to the orbit, as we can see here, dismantled cranium with skull and facial bones separated from each other. Just an example, this is a big tumor of the sinus extending into the orbital cavity, pushing the contents up and laterally. The other specialty is ear, nose, and throat surgery, ENT, which is closely related to the surgery of the orbit. And the sinuses are above and below the orbit on the anterior view, and also behind the orbit. So they are literally circumferentially surrounding the orbit, except laterally. And this, the nasal cavity is open, and it's in great vicinity to the orbit, and the sinuses are in great vicinity to the orbit, as can be seen here. The maxilla, the antrum is there, and the nasal cavity is showing. This is just an example. This is a mucosid of the ethmoid sinuses, and we can see that it has gone in the nasal cavity and inside the orbital cavity. And that's tumor at the base of the skull involving the orbit and the ENT field in a great deal. The other specialty is plastic and reconstructive surgery, which is related to the orbital teamwork. And the lids is not an easy job, it's not a simple thing. They are a complicated anatomy with many layers, as can be demonstrated here. And in a close-up picture, we can see the layers are very separate from each other, and they are very important to know and to deal with properly to get the maximum cosmetic results and functional results after surgery. Of course, the other specialty, which is very important specialty, is ophthalmology, eyeball and the area. And lesions in the eyeball may go inside the orbit and vice versa. Lesions in the orbit may damage the visual function and the eyeball. This is an example of a big tumor of optic nerve glioma. Thank you very much.